A resident with major depression begins refusing meals. What is the CNA's first appropriate action? A. Insist they eat immediately. B. Report the change to the nurse. C. Remove the tray and skip monitoring. D. Ask another resident to encourage them. Answer: B. Sudden refusal to eat can signal worsening depression and requires prompt nursing evaluation. A resident repeatedly states, "I feel like no one listens to me." What response best supports their emotional needs? A. You always say that. B. Let's sit and talk. I want to understand. C. You're just stressed. D. Please calm down. Answer: B. Validation and active listening build trust and emotional safety. A resident with anxiety often paces the hallway. What should the CNA do first? A. Tell them to stop pacing. B. Offer a quiet area and ask what is worrying them. C. Follow them closely everywhere. D. Call family immediately. Answer: B. Providing calm and exploring triggers helps reduce anxiety safely. A confused resident shouts because they cannot find their room. What is the CNA's best action? A. Scold them for yelling. B. Redirect and guide them gently. C. Lock their door. D. Tell them to sit down and wait. Answer: B. Gentle redirection reduces fear and confusion. A resident with dementia becomes suspicious that staff are stealing. How should the CNA respond? A. Laugh it off. B. Argue and prove you're innocent. C. Reassure them and redirect the conversation. D. Ask other residents to correct them. Answer: C. Paranoia requires calm reassurance, not confrontation. A resident experiencing grief after a loss shows withdrawal. What is the appropriate CNA action? A. Force conversation. B. Encourage small interactions and report changes. C. Tell them to move on. D. Ignore the behavior. Answer: B. Gentle support and timely reporting help monitor emotional health. A resident with PTSD becomes startled easily. What should the CNA avoid? A. Announcing yourself before entering. B. Using calm, slow gestures. C. Approaching them silently from behind. D. Respecting personal space. Answer: C. Unexpected approaches can worsen PTSD symptoms. A resident refuses morning care due to depression. What should the CNA do first? A. Offer choices and return later. B. Tell them refusal is unacceptable. C. Document it and ignore it. D. Allow them to skip care for days. Answer: A. Offering control supports emotional well-being and dignity. A resident expresses suicidal thoughts. What is the CNA's immediate responsibility? A. Keep it secret. B. Report it to the nurse immediately. C. Leave them alone to rest. D. Tell them they don't mean it. Answer: B. Any suicidal expression must be reported immediately. A resident with dementia begins wandering at night. What should the CNA do? A. Apply restraints. B. Guide them safely and notify the nurse. C. Turn off hallway lights. D. Ignore the wandering. Answer: B. Safe supervision and reporting prevent harm. Which action best supports a resident's autonomy in mental health care? A. Making decisions for them. B. Offering choices whenever possible. C. Rushing through routines. D. Limiting their involvement. Answer: B. Choices maintain independence and control. A resident with schizophrenia says they hear voices. What is the best CNA response? A. Those voices aren't real. B. Tell me what makes you feel unsafe. C. Stop imagining things. D. Ignore them. Answer: B. Address feelings, not the hallucination content. A resident with cognitive decline forgets their daughter visited earlier. What is the CNA's best approach? A. Correct them aggressively. B. Argue for accuracy. C. Respond kindly and redirect. D. Make fun of them. Answer, C. Redirection avoids distress and confusion. A resident with panic disorder experiences shortness of breath. What should the CNA do? A. Encourage slow breathing. B. Tell them to snap out of it. C. Leave the room. D. Ask them to walk quickly. Answer, A. Slow breathing helps reduce panic symptoms. A resident begins crying suddenly. What should the CNA do first? A. Offer tissues and allow them to express feelings. B. Tell them to stop crying. C. Walk away. D. Change the subject immediately. Answer, A. Acknowledging emotion supports mental health. A resident says the staff dislikes them. What is the CNA's best reply? A. That's not true, we're here to help. B. Stop thinking like that. C. Nobody said that. D. Don't talk about that. Answer, A. Reassurance helps reduce insecurity and mistrust. When assisting a resident with memory loss, the CNA should focus on A. Long explanations. B. Clear, simple, step-by-step cues. C. Correcting every error. D. Lecturing them. Answer, B. Simple instructions improve understanding. A resident experiencing loneliness benefits most from A. Being left alone all day. B. Social activities and meaningful interaction. C. Punishment for isolating. D. Locked doors. Answer, B. Social engagement supports emotional well-being. What should the CNA do if a resident with depression sleeps excessively? A. Drag them out of bed. B. Report the pattern to the nurse. C. Allow days of uninterrupted sleep. D. Criticize the behavior. Answer, B. Oversleeping may indicate worsening depression. A resident with bipolar disorder is unusually talkative and energetic. What is the CNA's priority? A. Encourage overstimulation. B. Maintain safety and structure. C. Leave them unattended. D. Argue with them. Answer, B. Manic phases require structured, safe environments. What is most important when communicating with a resident with dementia? A. Speaking loudly. B. Using short, calm phrases. C. Giving complicated choices. D. Talking quickly. Answer, B. Simple, calm communication improves understanding. A resident with schizophrenia becomes frightened by a hallucination. CNA should A. Validate their fear and offer reassurance. B. Tell them it's their imagination. C. Ignore them. D. Joke about it. Answer, A. Acknowledging feelings reduces anxiety. A resident at risk for self-harm must be A. Left alone for privacy. B. Observed and reported immediately. C. Ignored. D. Restrained without approval. Answer, B. Safety and reporting are essential. A resident refuses group therapy due to social anxiety. CNA should A. Force participation. B. Offer calm encouragement and alternatives. C. Shame them. D. Argue firmly. Answer, B. Respecting emotional limits encourages trust. When assisting a resident who recently lost memory abilities, the CNA should A. Demand perfection. B. Provide memory aids like calendars. C. Avoid offering support. D. Encourage isolation. Answer, B. Visual cues help maintain independence. A resident cries during bathing due to past trauma. CNA should first A. Stop and ask what is causing distress. B. Continue quickly. C. Ignore the fear. D. Call family immediately. Answer, A. Trauma-informed care requires understanding triggers. A resident with depression expresses hopelessness. CNA must A. Report it. B. Ignore it. C. Argue. D. Tell them others have it worse. Answer A. Hopelessness is a warning sign needing evaluation. A resident with Alzheimer's believes it is 1970. CNA should A. Argue the correct date. B. Enter their reality and redirect gently. C. Show frustration. D. Force orientation. Answer B. Validation reduces agitation. A resident with mental illness becomes verbally aggressive. CNA should first A. Stay calm and maintain distance. B. Shout back. C. Physically restrain. D. Walk away without assessing. Answer A. Safety and calm tone help de-escalate. What supports a resident's mental well-being during rehabilitation? A. Setting realistic achievable goals. B. Demanding instant progress. C. Removing choices. D. Rushing therapy. Answer A. Achievable goals improve motivation and confidence. A resident with cognitive decline struggles to choose clothes. CNA should A. Offer two simple options. B. Present a full wardrobe. C. Force a decision. D. Ignore the issue. Answer A. Limited options reduce confusion. A resident becomes fearful at night due to dementia. CNA should A. Leave lights off. B. Provide a nightlight and reassurance. C. Ignore them. D. Scold them. Answer B. Gentle reassurance improves safety and comfort. A resident's cultural beliefs affect how they express sadness. CNA must A. Respect and acknowledge cultural differences. B. Force typical expression. C. Criticize their culture. D. Ignore their emotions. Answer A. Cultural competency supports emotional care. A resident refuses medication due to paranoia. CNA must A. Never give medication. B. Report refusal immediately. C. Force the medicine. D. Hide it in food. Answer B. Medication refusal requires licensed evaluation. When a resident shows signs of emotional abuse, CNA should A. Report it immediately. B. Ignore it. C. Confront the suspected abuser directly. D. Wait for proof. Answer A. CNAs are mandatory reporters. A resident says, I feel like a burden. CNA should respond A. You're important and valued here. B. Stop thinking that way. C. Yes, you worry too much. D. Don't talk. Answer A. Affirmation supports self-worth. A resident with sensory overload prefers quiet spaces. CNA should A. Bring them to noisy activities. B. Provide a calm environment. C. Force interaction. D. Turn on loud music. Answer B. Reducing stimuli prevents anxiety. A resident with dementia keeps repeating a question. CNA should A. Respond patiently each time. B. Show frustration. C. Ignore them. D. Tell them to stop. Answer A. Repetition is a symptom, patience maintains trust. A resident with depression begins giving away possessions. CNA should A. Report to nurse immediately. B. Encourage giving away more. C. Ignore behavior. D. Hide their belongings. Answer A. This may be a sign of suicidal ideation. A resident experiencing delusions believes staff are plotting against them. CNA should A. Acknowledge their fear and stay calm. B. Agree with the delusion. C. Challenge it aggressively. D. Laugh at them. Answer A. Supportive reassurance reduces fear and maintains safety.